What's up, guys? This video we're going to cover bleeding and the different effects. We're going to start out over here with your pulses. So your carotid pulse, which is the one in your neck, you're going to get about 60 to 70 for your blood pressure there. And PAL is palpation. So when you hear one of us say pressure is 60 over PAL, that's what that means. Usually, if we're using palpation method, that means that we can't listen and do the normal blood pressure. So a noisy theater, in a helicopter, something like that, where we don't have a machine that's going to do all the readings for us. Your femoral, which is down here in your leg, that's going to be 70 to 80 beats. And your radial pulse, which is right here in your wrist, that's going to be your normal one, which is 80 or more. Usually, if we're just looking for your radial pulse when we come up on you, somebody that has a radial pulse is going to get just a saline lock, which means you're not going to get fluids right away. Somebody without bilateral, so both sides, they're going to get an IV and fluid resuscitation immediately. We'll cover that in a minute over there. So one of the things that's going to happen when you bleed and you don't stop the bleeding quick enough is you can get hypovolemic shock / hemorrhagic shock. Hypovolemic is low volume, so all your fluids are low. And most of the time in our case, we're going to have to deal with the hemorrhagic, which is when you're bleeding too much. All this starts to kick in with about 20% blood loss, which is about 1/5. You have about 5 liters of blood in your body. For an average person, that is 150 to 180 pounds. Eventually, it can lead to organ failures, which is not good. Usually, the brain is the last to go because the body wants to protect the brain as much as possible. So you're going to start seeing your less important organs fail first: kidneys, appendix, that kind of thing. You can have 2 different sources for hemorrhagic / hypovolemic shock. You can have internal bleeding and external bleeding. Most of the time, if somebody is shot, they're going to be external bleeding, unless it's somewhere in the gut or the chest. You can have prolonged diarrhea, which will also give you hypovolemic shock. Severe burns. We'll cover why that happens with burns later in a burn video. Vomiting and excessive sweating. These last 2 can also be a symptom of heat-related injuries, and we're going to talk about that in a later video as well, especially coming up here with annual training down in California. It's going to be hot, and we're going to need to replace fluids as much as we're letting them out. So your symptoms of hypovolemic shock, your milds are going to be a headache, fatigue, which is tired, nausea, profuse sweating, and dizziness. These also match up with your heat injuries. So keep that in mind. If you have somebody that's injured, but also, having these issues, they could have either or. Going down to the more severe stuff, you have your cold and clammy. On a side note, if you know somebody that's diabetic and they're cold and clammy, it means that their sugar is low. If they're warm and dry, it means their sugar is high. So the old saying is, cold and clammy, give them candy; warm and dry, sugar high. We won't have to deal with any diabetics necessarily unless we are involved in a civilian population. But there are instances where we can use up all of our blood sugar especially if we're not eating as much or we're in an environment where we're using a massive amount of energy. You're going to see people become pale, rapid, shallow breathing. So obviously rapid is very fast and shallow is not very deep. So it sounds something like this. Something similar to that. There's also some literature that has shown in some cases people having bradycardia, which is slow breathing. But from what I can gather, it doesn't happen very often. Moving on, little or no urine output. This is something that we would be more concerned about in a prolonged field care situation. So 6 hours or more usually. In our defined settings like Iraq, Afghanistan, something like that, transport times are usually about as good as here in life flight, about 30 minutes anywhere in Oregon. It's roughly the same in theater. Now, if we're going to, let's say all hell breaks loose in North Korea, flight times are going to be prolonged because we don't have that theater set up, which hopefully we don't ever have to go into something like that. Some more severeness, you're going to have some confusion, weakness, weak pulses, depending on how bad this person is bleeding out and has this shock. You may not feel your radial at all, which again, that's going to make you have an IV and fluid resuscitation. And in order of loss for being able to feel them, radial, femoral, carotid. So your carotid is going to be the last one to go. Your lips can turn blue as well as your fingernail beds. And that's because your blood perfusion isn't going. So if you go and push on your thumbnail, you'll see the pinkness go to white, and then you let go and it comes right back. That's a sign of good perfusion. And somebody that has hypovolemic shock or hemorrhagic shock, you're not going to have that as well, which means your pulse oximetry is not going to be as good. Again, lightheadedness, and LOC is loss of consciousness. What are you guys going to do specifically? You're going to stop the bleeding with tourniquets or pressure dressing, something along those lines. You're going to put them in the supine position, little misspell. You lay them on their back. You're going to raise their feet about 12 inches. That's going to help what blood that they do have left remain back in your core. Don't move them as much as possible. If for some reason you move them, they could potentially blow a clot, and that's bad because it'll lead to more bleeding. Hypothermia prevention, that's going to be huge. With blood loss, you're going to have different things that happen, and hypothermia is one of them. We all should know what hypothermia is. If you don't, it's when your body gets too cold. In this case, trauma-induced hypothermia is more dangerous than like your cold weather injury of hypothermia, because you don't have the blood to circulate heat around the body. Do not give them any fluids by mouth. Because as we mentioned, in our symptoms, you have nausea, potentially vomiting. They're just going to throw up those fluids, so don't give them anything. They need to wet their lips. Go ahead and put a little bit of water on a sponge if you have one, or some gauze, and let them suck on it or moisten their lips with it. But absolutely no drinking water or Gatorade. Moving along, prolonged hypovolemic shock can lead to organ damage. So potentially brain issues, other organs can be affected, kidneys, whatnot. Gangrene is something that can happen of your arms and legs. That's also something that's not very fun to deal with. And then heart attack, because you don't have the blood to circulate, so your heart is working harder and it's not going to be used very effectively. We can cover CPR in the field in a later video, but typically it's not that effective. I'll get you the stats on that in another video. Lethal triad, this is something you guys don't necessarily need to know, but I think it will be helpful for you to understand. As we mentioned, we have hypothermia, so being too cold, and again in this case trauma-induced hypothermia for the blood loss. Coagulopathy, that is your ability to clot, having blood, being able to clot. If you can't have any blood clots, you're just going to continue bleeding. And that's why we use we don't use quick clot anymore, but stuff like that, to where it's going to have that clotting agent in it. And then acidosis, this is something that we can't really figure out in the field. We don't have the equipment to do that. But if you have one or two of these, it's going to lead to the third. And if we can prevent either two of these in the field, that's going to increase our survivability rates. And hypothermia, that's an easy one, well, relatively easy one to help prevent. Get them the blankets, get them heating packs. Like I mentioned in our last video, even in the middle of the desert, in the middle of August, you can have somebody with hypothermia, especially in a trauma like what we could see, whether that's a blast injury or being shot. So that one's relatively easy to maintain and manage. Coagulopathy is a little more difficult, but we apply that tourniquet. That's going to stop the bleeding. We start packing those wounds with our combat gauze that has some stuff in the actual gauze that's going to help clot things up. So that's why when we convert our tourniquets and you apply the pressure dressings, you won't necessarily see a continued blood flow from that wound, because it has clotted, which is a great thing for us. And again, these two things, if we can control those and we can get them prevented, we don't have to worry about the third, which is acidosis. Again, we can't diagnose that in the field. But these all three play off of each other. Moving over here to our fluid resuscitation. This is not something that you guys need to know, but I feel like it would be helpful to give you guys a better idea of what we're going to do for somebody that's bleeding and has a bunch of blood loss. TXA, it's transischemic acid. It helps with clotting. Kind of a side note here, it can also be used on canines. I don't know if we will ever deal with canines in the field, but it is something that can be used. I can do another video later on about canine medicine. Given you, I am not a veterinarian whatsoever and have very little experience in that, but I know a lot of us do have dogs, and you know, a little bit of canine medicine can help. You know, Luna, I'm sure, goes out and hikes along with Churchville all the time. You know, she falls down, breaks a leg, he'd be able to help that situation a lot more and get her out of there. Moving on, so in preference from high to low, we're going to use whole blood. Then we're going to go down to plasma, red blood cells, and platelets in a 1:1:1 ratio. If we don't have all three of those, we're going to move down to plasma and red blood cells in a 1-to-1 ratio. If we don't have either one of those, then we'll just use the red blood cells or the plasma by themselves. As far as I know, in the United States military, we do not carry these things in the field. Other nations, such as the Brits, they have shown they've been known to use them in the field, and they have increased survivability rates. So really what we're waiting on is the FDA to give us approval to use that. Moving on to something that most of you know what they are. These things are going to be our less preferred in terms of fluid resuscitation with hypovolemic shock from bleeding out. We're going to use our Hexten. This is going to be administered at a bolus, which is the line wide open, 500 milliliters. Then we're going to wait 30 minutes. If we have not gained our bilateral radial pulses, again, that's each wrist, then we're going to administer another 500. If at that time we still have not gained pulses back, there's something wrong that we can't fix in the field. So if we're in a prolonged field care situation, they could die. We need to get transport there as soon as possible. Lactator ringers. This is something that's more useful for burns. It matches up more with your normal pH level of your blood. So you'll see a lot of, or not a lot, but physicians in the ER, some of them are starting to move over to lactator ringers versus normal saline for different things. And then lastly is your normal saline. These two things are what I carry in my bag right now. When we move on to theater on an upcoming deployment, I'll be carrying Hexten. Maybe if the FDA gets in gear, some of these things up here. Most likely not, but it would be cool to see some of that stuff issued in the field. And again, from whole blood all the way down to normal saline, those are your things that are going to be in order preferred. Some blood by the numbers. The average person, like I mentioned, is 150 to 180 pounds. You're going to have between 4.7 and 5.5 liters, which is about 1.2 to 1.5 gallons. For sake of argument, we're just going to say everybody has 5 liters of blood. And we're going to do a video in a little while here what all this actually looks like on the ground. But typically, if you're getting a blood panel done, so you're at the doctor and they need to draw blood, and we call it a rainbow. So you got 4 tubes. That's going to be about 10 milliliters of fluid. When you donate blood, you're going to donate about 500 milliliters, which is a pint. So that's your small bag of fluids. At 1 liter, you can start seeing these hypovolemic shock and all of these symptoms here. But you can still stay in the fight at 1 liter. At about 1.25 liters, you're going to start getting tunnel vision, and you're going to want to take that weapon away from that person. At 2 liters, you're going to have a hard time bringing somebody back from that. I mean, I will do my damnedest, but that's going to be a tough save there. That's all I've got for the moment. In a little while, I'll post another video of some representation on the ground. It's just going to be water but it should give you guys a little bit better of an idea of what all these blood by the numbers looks like on the ground. I hope you all are having a good day. I'll see you in the next video.